Hi, I'm Jillian. I'm from Queensland, Australia. I'm in my 40s and I was diagnosed in 2010 with DCIS and invasive cancer of the left breast. I had a modified mastectomy. I was ER positive, PR positive, and lymph node negative. My words of wisdom today are for the phase of radiation in the breast cancer treatment. The issues that I experienced during this phase were the obvious issues that we all have, which is the fear of skin damage, the burning and the blistering that we get, in particularly towards the end of the 6 weeks of radiation. I had also survived surgery without lymphedema and was informed that radiation could increase the risk of lymphedema as the tissues in that area that received radiation would be damaged, and along with that would be the lymph nodes. I had a few breasty friends that had got lymphedema from radiation, so I was very keen to focus on my lymphatic system being maintained throughout the 6 weeks of radiation. So what did I do to get through this phase? I have a brother that's an acupuncturist, so the first thing I did was to go to an acupuncturist and organise a weekly visit. They would stimulate my meridians and my points that released heat from my body, particularly the meridians that ran through my left breast. I also asked them to mark those points on my body, and I would stimulate those points a couple of times a day throughout the 6 weeks of radiation. The second thing I did was negotiate with an oncology masseuse to organise 2 lymphatic massages a week for the 6 weeks of radiation. The focus was to ensure that the lymphatic system continued to flow through that radiated area. Under her instruction, I also did some self-massages, both morning and night in the shower, and that was really easy to do. The third thing I did was shallow breathing, or you could also call it belly breathing. And although the radiation nurses said it would make absolutely no difference at all, it certainly made a lot of difference to my head. I had confirmed with the radiation oncologist that the radiation beams had passed through the edges of my lungs and my heart. So even if I could save a centimetre of those beams going through those organs, then it was certainly good for my mental state. So to do that, I would practice by putting the hand on my chest and breathing very shallow through the chest, but breathe into your belly. So I'd watch the light on the wall, and as it came on, I would slow my breathing down, breathe through my belly, and try and keep my chest as even as possible so it would not rise and fall as it would in normal breath. So I don't know whether that worked or not, but it was certainly good for my head. The fourth thing I did was to access a product called Radx, R-A-D-X. It has 2 products. The first is a moisturiser which hydrates your skin in preparation for radiation and can be used throughout the entire phase of radiation. They have a second product which has lidocaine in it, and normally when you get to the pointy end of your radiation around week 5 or 6, you can experience some sensitivity and some heightened burning from the radiation. With the lidocaine in it, it actually decreases that sensitivity and that pain. I've found that using the hydration moisturiser throughout the whole of radiation, I didn't need the second product with lidocaine in it towards the end much at all. So it was a great product. I would certainly recommend it. I believe it's manufactured in the United States. It will be manufactured shortly in Australia, and you can access that on the internet via their New Zealand website, and they can have that product to you within a couple of days. I ended my 6 weeks of radiation without any blistering or burning or any issues with my skin at all, and without any lymphedema. So I was very pleased with my strategy to get through my 6 weeks of radiation. I hope this information has been of value to you, and I wish you all the best on your journey.